My name is Stephen Hamlin. My website is mybodycanlearn.com, and this is number 5 in a series of little videos on how to help yourself with chronic or acute neck pain, neck trouble, compression, any kind of anticipated surgery if you have trouble with the neck. And this is a little movement that will relieve tension at the suboccipital muscles. If you've had whiplash, this is a very good movement to learn. It's difficult to learn the movement, but once you learn it, it's easy. And I call it circumduction of the head. And it's, if you can imagine a cup on a stick, and the cup is just rolling on the stick like this. If there's a membrane on the edge of the cup can just roll like that very easily. The weight of the cup, the weight of the head is over the neck. The top of the neck, between the ears again, directly between my fingers. And see, I can nod my head yes, I can turn my head no, there. But what if I make a circle, a little circle, as if there was a pencil at the top of my head, making a little tiny circle on the ceiling. Now, in order to do this movement, you have to relax into it. You can't force it. If you try to force it, you tighten all the muscles, and there's no possible movement at the top where the skull rests on the top of the spine. We're talking about letting the skull rock in a circle on top of the spine. So it's a combination of flexion, extension, rotation, side bending. And when you do it correctly, you'll see people quiet down, and they go inside, and they get this look of absorption. It's kind of like, looks a little like this. Quiet down, they feel the weight of the head on top of the neck. Go back between the ears, see if you can feel where the head rests. You make this very slow, easy movement. And if you do it correctly, you'll feel as if the movement's happening way up at the nose level. Small, you have to relax into it. It took me, after my severe 1987 full extension whiplash, it took me like 5 or 6 years to be able to do this movement. At first, I was so tight, I would do it down here. It would look like this. Even with the chest, like I'm doing now, like the whole body. Couldn't imagine relaxing the top of the neck where it meets the skull. And see, what happens in a whiplash is the head is whipped away from the spine. And the body says, we're not going to allow the brain to be pulled out by the roots. So what does the body do to not allow this in a split second, by surprise, in a car accident, say? The body will grab those muscles so tight that they may never again release in your entire life. It's like, argh! And then you come to me, or you come to a chiropractor, and you have neck pain and compression, and you need surgery. And to turn the head, you get cracks and pops. And you try to do exercises, and you do stretching, you do all these things. Never once trying to get to the cause of the problem, which is those muscles that have grabbed from 20 years ago that you see. Now, in the Feldenkrais method, we have a little idea that if you want to relax a muscle, you teach a movement that requires the muscle to relax, instead of trying to stretch or strengthen or inject or do anything external, manipulative. What is natural is create a movement that requires those muscles to relax. So you cannot have those muscles at the base of the neck grabbing so tightly. If you can do this delicate little easy movement that you have to relax into, if you can do that movement, now it may take you a year to slowly layer down the tension, layer down the effort, to where you can make this little, I call it circumduction of the head on the neck. If you do it correctly, the face will be forward. You won't see the face go like this. This is not the movement. It'll be as if a pencil is making a circle on the ceiling. It'll be as if you have a funnel. The neck is the neck of the funnel, and the head's in the bowl of the funnel. And the head is rolling very slightly in the bowl of the funnel. The neck doesn't move, because you're rolling the head on top of the neck. So nothing below here moves. It's a very difficult movement to learn. If you understand it intellectually, like what I'm saying, in time, if you relax into it and don't try to do it, you will get it. But it takes time and persistence. Maybe it'll take you a year to actually get it, where you can do it more or less like I'm doing it. It's taken me many years to be able to do this. And even now I have to really relax and really close my eyes and get into this slow, little circular movement, like a pencil pointing to the ceiling, making a circle the size of a dime. And you can't force this movement. You have to relax into it. You have to relax the belly. You have to breathe easily and play with it. And it will drive you nuts. You try it for 30 seconds a day, then you give it up, and you try it the next day. Because the brain has to think about this. It's not something you can just force yourself to learn to do it.